Welcome everyone to this webinar today, where we're going to be launching DFID's position paper and theory of change on mental health and international development. We will start in a couple of minutes, but before we start, can I just ask someone to tell me if you can hear me okay and see me okay?
Looking good, Julian.
Great. Okay, thank you. It's always a bit strange talking into the ether, although we've got very used to that over the last few months. So, welcome everyone. This is an exciting day for us at the Mental Health Innovation Network and BOND, because this is the culmination of a very long process of working closely with DFID colleagues and many other civil society organizations in developing what I think is an important landmark, really, in thinking about mental health as part of international development and a very important organization's role in that. We're going to be hearing a little bit later from a couple of people within DFID, who I'll introduce at the time, who will be giving us a bit of an insight into the way the organization's been thinking about mental health, and that's reflected, of course, in this document and others. Then we're going to be hearing from Tom Shakespeare, who's a colleague of ours at London School of Hygiene and Tropical Medicine. And then we have a panel of people who've been working in the field, some of whom participated in the development of this document and thinking really through the practical implications of what it contains. There's a few things I'd like to say before we start. First of all, that there is a lot of information for people who might be interested in reading further. Of course, this document itself, which is now live online, and also the couple of other documents we're going to be talking about. My colleagues in a minute are going to put up a link in the chat, which will take you to a page on the Mental Health Innovation Network, which has these resources on it. There's also a couple of the slides coming up that will have the links as well for you to be able to find those documents. As you can see from the page on the screen at the moment, we are tweeting live on at MH Innovation, and we'd really encourage those of you who are Twitterers to carry on with that conversation. We are also recording today, so there are too many people to be individually able to give your consent, but I hope that's okay with everyone, and if you do not want to participate in that, please leave now. But I think the important thing for us is that we had a lot of people who said that they wanted to be able to listen to this later, and we want to make it as widely available as possible because we've had a lot of interest in this webinar. We also really want to hear from you. So there will be opportunities to participate in the question and answer session at the end. I think it's too complicated with this number of people to be opening up all the microphones, but we have some people who will be looking in the chat for questions and organizing them so that we'll be able to bring up the key questions at the end, both for our speakers from DFID and also our panelists who will be speaking at the end. So please, I would encourage you to write your questions in the chat, and we'll hopefully be able to have enough time at the end to get through as many of them as we can. Finally, if you want to be able to follow up on the information that comes out of the session today, to be able to access the recording and a lot of other important information about global mental health, and the field more broadly, then I would encourage you to sign up to the Mental Health Innovation Network, which will be sending out a newsletter very soon about this event, and will also be continuing to keep the field updated as it has done for a number of years now. So I want to thank all of you for attending, and particularly our speakers today. BOND and MHIN have been working for a long time with DFID, and it has been organized really under the Inclusive Societies Department of DFID. The mental health work, as you know, is very cross-cutting, and we've really valued the collaboration with the Inclusive Societies Department at DFID. And I want to particularly mention Jessie Kirk and Penny Innes, who really drove a lot of that work during its development. But without further ado, I want to introduce Diana Dalton, who's the head of the Inclusive Societies Department, who's going to say a few words for us now.
Can you hear me now?
We can now, thank you.
Great, okay. Sorry, I think we were both trying to unmute me at the same time. Thanks very much for the introduction, and I'm not going to take up too much of today's time because there are people with far greater expertise than me who I know we want to hear from today. But I wanted to firstly say thank you to everybody who's joined us. It is a really timely event. And I want to first start, of course, with saying thank you to the Mental Health Innovation Network at the London School and the Bond Disability Subgroup on Mental Health for hosting today's launch. They've also provided a huge amount of work and guidance in producing the documents we are here to launch today. So that partnership, your leadership and support is, as ever, incredibly appreciated. And thank you in advance to the speakers who are joining us from all around the world to share their insights and expertise on working on these really critical mental health issues in development from their different perspectives and contexts. I'm sure that will be hugely rich in content and we'll get a lot out of it. So my job today is just to do a quick bit of scene setting and also to update you on what DFID has been doing in this area. And this is obviously the backdrop as to why we are here coming together virtually. I'm conscious of trying not to tell you too much that you already know, but just to kick off with a few headlines. We know that mental health is a critical issue for development agendas. Pre-COVID, we know that mental ill health contributes 13% of the burden of disease. And the issue has been for a long time underfunded, particularly in low and middle income countries, with between 75 and 85% of people with mental health conditions receiving no treatment at all, despite evidence of effective interventions being able to be delivered in such contexts. The added challenge and complexity of countries' handling of COVID-19 and the nature of the response to COVID, like lockdown, are clearly contributing to the social detriments of poor mental health across all areas of life. And we know that goes beyond the traumatic effects of illness and death to severe impact on livelihoods, disrupted education, increased domestic violence and more. You'll all, I expect, recall DFID hosting the Global Disability Summit in mid-2018 alongside its disability inclusion strategy, which still stands, of course, today. Is guiding our work. So I wanted to talk quickly about the mental health aspects of that strategy and what we have been focusing on over that period of time. So we've had a focus on improving learning and knowledge on mental health. We've designed and rolled out an ambitious learning journey, but a bit jargonistic, but an internal term for building up a much stronger understanding and knowledge base around issues on mental health for DFID staff to equip us to step up and do more and do it better on mental health. So 4 training courses have already been rolled out, reaching around 120 advisors and program staff around the organisation who work on a range of thematic areas and in a range of countries. And this exercise also produced new learning materials, from educational videos to infographics and a good new topic guide, which have been made available to the wider public as well via the K4D mechanism and NHIN. The topic guide has now been downloaded several thousand times, so that is an indicator of what value it's had. We have made financial pledges, so we've matched £2 million of public donations to support mental health programs across sub-Saharan Africa, which was part of a comic relief program. We are providing pioneering support through a flagship £30 million Leave No One Behind programme in DFID Ghana, which seeks to provide 250,000 people with access to quality mental health services through primary healthcare. This also includes mental health and psychosocial support in conflict, because we know support to those with physical disabilities in conflict is not adequate by a long way.
Mm-hmm.
And our main focus is on education in emergencies, as we know children can't learn effectively if they are distressed or traumatized. We're one of the first donors here and have invested £5 million into the Education Cannot Wait programme to support children in crisis settings while they are out of school, including with mental health and psychosocial support interventions. In 2018, we also matched up to £500,000 raised by War Child in public donations to provide targeted psychosocial support to 400 children, and further generalised support to 3,000 children traumatised by war in the Central African Republic. In addition, we've made significant contributions to the international effort on this agenda. Obviously, quite a lot of DFID's value comes from influencing others who have the capacity to do more. So in October 2018, the UK hosted its first ever Global Ministerial Mental Health Summit, and DFID worked closely with the Department of Health here in the UK on the shaping of the summit. And building on this legacy, we've now set up the first donor group on mental health and psychosocial support in crises in partnership with the Government of the Netherlands. So we're continuing to support that group, which currently has 15 donors on board. So we're publishing our new position paper and theory of change today to act as a global tool for COVID-19 responses and to do more and expand work further still. So this is outlining a comprehensive and rights-based approach that promotes well-being for all. It improves access to quality services and support and realises the full rights and inclusion of people with psychosocial disabilities. The paper was developed through extensive consultation with the sector, so it's certainly not something that we have unilaterally produced it by any means at all, and it provides practical advice for those inside DFID but also beyond as a global good on how to support those with mental health conditions and psychosocial disabilities. So today's event is designed to just create a moment where we can all come together and learn from those who know best, talk about the risks and challenges particularly presented by COVID-19's impact on mental health, and also to share best practice and advice on where we can place our efforts in the future. Because now there is the opportunity, as we all know, to put the poorest and most marginalised at the heart of all of our COVID-19 responses and build a much stronger future for them all. That's enough from me, I think, but I am delighted now to hand over to Alastair Aja, who is the Deputy Chief Scientific Advisor here at DFID and much more of an expert on this area than I am. And also I'm sure he's known to you all, he's a professor at Queen Margaret University here in Edinburgh, where we're both sitting in separate parts of the city. So over to you, Alastair.
Thanks ever so much, Diana. And just to add to her, thanks for the engagement and the opportunity to talk about this work. And I just want to give a little bit of a context for the development of this work within DFID. And I guess I feel I need to start where Diana started, which is in the magnitude of the need. She mentioned 13% global burden of disease attributable to mental ill health. Although if we look at years lived with disability, that rises to 20%. We heard about the treatment gap of between 75 and 85% in many low-income countries. We know that globally expenditure on mental health from governments is in the order of 2% of health budgets. We know that if we're talking with economics colleagues, ministries of finance and other governments, that we could point to 12 billion productive days lost each year due to mental ill health. So many on this call will know the magnitude of that need, and I think the field has become much stronger in articulating those needs. What has been challenging for many agencies, and I think I would include DFID as a government department within that, is translating that sense of need, that sense of importance, that sense of importance into tangible response, and to be able to provide a framework, rail lines, if you like, for an agency to be able to strategically respond. And it's with respect to that we're so pleased to launch this position paper to talk about the theory of change, which, as Julian noted right at the head, is very much a co-production of many experts in the field. In terms of response, I do want to note the learning journey that Diana spoke of, and the relevance of that in terms of shaping a topic guide that has been downloaded over 1,000 times since its production, which provides some framing for the discussions within DFID and with expert colleagues for the development sector. And I really encourage you to look at that resource. And I think it makes the case I wanted to make now quite strongly, in that there's an early chapter of that topic guide very much about making the case for mental health. And we often will have to start there, and recognizing that there's a public health case, there's an economic case, and there's a human rights case. And the framework we want to share is very much one that respects and acknowledges all three of those complementary avenues for arguing for the importance of investment in mental ill health and addressing psychosocial support for populations. And then that document begins to go on in terms of identifying resources and policy directions and the research and evidence supporting action. So that is a key paper, and I really encourage you to access that. But developing out of that learning journey is this theory of change and the position paper. And Julie and others, if you're able to put that theory of change on the screen in a moment, I'll be very happy for you to, because it will help me just talk through a little bit of that. Some of you, in fact many of you, will probably be familiar with this sort of table, and maybe occasionally resent the challenges that such framings impose upon us in terms of program design. But many of you will also probably recognize the potential huge utility of the knowledge and the wisdom that's gone into crafting something of this order, which frames how experts within the field consider that we can address this vision of improved all people with mental health conditions and psychosocial disability exercise their full rights on an equal basis with others. So this is the intelligence of a community reflected in a particular framing. I want to go through it in a little bit more detail, but the key thing for me and for DFID is that in our discussions, such a document helps us with ministers or with senior colleagues to translate from that vision that few will disagree with as being important, through key outcomes, and particularly these pathways to impact through which investments can be made to have impact in those outcome and vision areas. And also to note, just at the foot of the table, the acknowledgement of the barriers that we will need to overcome. And so this is a table that not only reflects our ambitions, it reflects wisdom about the way to achieve that ambition. And I'm particularly proud of the breadth of engagement and the breadth of pathways that are considered by this framing, and the breadth of development actors it then calls to engage within this work. As you'll see from the diagram, particularly if you look at the numbers, the 1, 2, 3, 4, 5, you'll find them in the outcomes area. We're really saying that there's 5 key entry points we see in this agenda, acknowledging that many agencies have a capacity, particular added value to engage in particular parts of this work, and obviously within BOND itself, the complementarity of multiple agencies. And so this is a framing that we hope can leverage multiple actors, including, as Diana was saying, a number of donors coordinating together in terms of working on complementary aspects of this framing, but working towards that common vision. And so the entry points that we see as being really significant are, first of all, participation, and you'll see that framed very centrally in terms of the framing, ensuring people with mental health conditions and psychosocial disabilities are empowered to advocate and meaningfully participate in decision making at all levels of society. And this is the one bit of my spiel that I will read, because The framing, these words are carefully crafted, will be used by multiple program officers, will be used in bilateral discussions, hopefully will be used by agencies in thinking around appropriate interventions to help us craft in a careful way appropriate modes of intervention. So if participation is the pathway to which we're entering this agenda, we're seeing the entry points include supporting the establishment and sustainability of representative organisations, enabling meaningful inclusion and decision-making, the development and implementation of legislation and policies, supporting meaningful participation and user involvement in system strengthening. So that, even within that one entry point, provides a number of pathways to work towards participation. As Diana said, this has very much been framed in our dialogue with colleagues in a rights framework. So rights is another key entry point into this agenda we see. And there it's people with mental health conditions and psychosocial disabilities being included and enjoying and exercising their full human rights. And through that entry point, or entry points to support that pathway of change, developing standalone national mental health policies, reviewing and removing discriminatory provisions in law and policies, investing in innovative practices to prevent and end coercion, including the long-term process of deinstitutionalization. Those entry points are all major challenges in themselves, but you obviously see that the sense of this, of aggregating smaller focused actions in terms of supporting the fuller, wider vision. I do want to cover all of these areas. So leadership and governance, we can do work on participation, we can do work on rights, but it's key that that's complementary investments on really ensuring leadership and governance for the field advanced for mental health at all levels and across all sectors. That's a grand claim. So what are the entry points for that agenda? Supporting integration of mental health into global and national frameworks and sectors, including SDG national plans, and integration into national action plans to achieve universal health coverage, which is a key policy goal of DFID and the FCDO in terms of our health investments and framing universal health coverage. Fourth of five, promotion of well-being for all and quality services and community interventions. The earlier entry points and pathways of influence very much in terms of advocacy, participation, rights, leadership and governance, but the quality of programming and the quality of interventions is clearly crucial. And so entry points for that we consider about improving well-being for all and addressing social and environmental determinants, which includes inclusive education, healthy living and working conditions, strong protection mechanisms, supporting high quality mental health services, including the integration of those into public health systems. And then finally, an area of particular concern within DFID and the focus of that donor group in terms of mental health in emergencies and fragile humanitarian contexts, ensuring that mental health is prioritised there. And for that area, entry points include provision of culturally appropriate focused mental health and psychosocial supports, capacity building, social welfare, and including the well-being of humanitarian staff and volunteers. So I'm half apologising for reading that, but I wanted to pay respect to the density of insight and wisdom in the framing of this, the co-creation of this framework that I anticipate will be very well used in the coming years. In drawing my comments to a close, I then want to, and I'm partly setting up Tom, who'll be speaking next, I want to recognise that this is a very particular point in the agenda of all of us that care about mental health and psychosocial support in the era and the context of COVID, and how this will support our actions in that area. It's a particular personal concern for me. Many of you will know that the role of Deputy Chief Scientist is a secondment. I'm coming to the close of my secondment period with DFID and returning to academia with a very much engaged in global mental health. And I'm proud to have been a cheerleader for this work, very much not involved in the nitty-gritty of it. I'm delighted that this is now something that those of us that are active in this field can refer to and leverage in terms of our discussions. In terms of COVID, I think we really recognise the valuable work of WHO, the IASC and other groups, including the Mental Health Innovation Network, in documenting the impacts on mental health of COVID, and indeed the impact of mental health consequences on subsequent recovery, the longer term and indirect impacts of that. We've only, I think, begun to scratch the surface. I'm looking forward to what Tom will highlight in terms of what we're learning about working in this field in the context of COVID and response. But we know through colleagues at WHO and a number of studies, examples of major increases in rates of depression. There's a study that many have cited about a threefold increase in Ethiopia in the early months of lockdown. Frontline health workers, a major study in China documenting significant burden associated with health workers directly involved in pandemic response. We know that the impacts of mental health on utilization of other public health services. We know also about the consequences on other social dimensions, including intimate partner violence. This is a huge agenda that we are only beginning now to scratch the surface of in finding strategies to address. And we do hope that and envisage that the theory of change will give us that rail line, that framework to be able to respond to this in a coherent way. To conclude on that, in terms of DFIDs understanding, we do urge governments to make fully integrated provision in their COVID responses, acknowledging that the economic and social impacts of COVID, and including the responses to COVID in lockdown, will have major mental health implications. And we fully support the WHO line on this, that what is required is a whole of society approach to protect mental health, ensuring all policy levers, not just within ministries of health, but throughout government, to ensure resilience within communities is supported. But we do see the need for ensuring the availability of emergency mental health and psychosocial support. And then critically, on utilizing the challenge that COVID provides us to ensure that we build back better in terms of mental health services through the reconstruction and response to COVID, both in terms of universal health coverage and in particular understanding the emerging needs following the pandemic. So that's just building on Diana's comments from a DFID perspective. I'm very happy to hand back over to Julian, who I think is going to introduce Tom, but just thanks again from DFID colleagues for all the engagement with our civil society colleagues in framing such a useful document. Thanks, Julian.
Thank you so much, Alastair, for taking us through what is a very rich and quite detailed document. I can assure you that every word was discussed in great detail. So I would really encourage people to take the time to look at it, and also the topic guide, which I think has many of the similar linked themes. And it does provide a good frame for the work many of us are doing in development and research.